Hello and welcome. Today, we're not just looking at a crime story. We're going to conduct what is essentially a clinical examination of a system at its breaking point. We're going to dissect an event so profoundly shocking that it forced an entire country to confront the deep, festering wounds within its own healthcare system. So, let's begin. Right from the outset, this single comment left on a memorial post for the victim really tells you everything you need to know about the public's reaction. It's chilling, isn't it? It perfectly mirrors the cold corporate language of the insurance industry itself. This tells us that this was never going to be a simple story about a murderer and his victim. It was immediately framed as a referendum on the entire system that the victim represented. All right, so let's start with the hard facts of the crime itself. This was not some random act of violence, not at all. All the evidence points towards something far more disturbing, a meticulously planned, brazen assassination, carried out in broad daylight on one of the busiest streets in the world. So let's break it down. The who? Brian Thompson, the CEO of United Healthcare, which is the largest health insurer in the United States. The where? Right outside a major hotel in Midtown Manhattan, where he was scheduled to speak at an investors' meeting. And the when? Just before 7 in the morning. This wasn't just a murder, it was a public execution, clearly designed to send a powerful and terrifying message. Now, if you look at this timeline, what's truly striking is the sheer methodical patience and preparation involved. The alleged shooter, Luigi Mangione, arrives in New York a full 10 days before the attack. He uses a fake name, stays in a hostel, and spends his time doing reconnaissance of the area. On the morning of the killing, CCTV footage shows him smiling, calmly ordering a coffee. During the attack itself, his weapon, a partially 3D-printed untraceable ghost gun, actually jammed. But he didn't panic. He coolly cleared the jam and fired again, ensuring his target was dead. His escape was just as planned. He fled on an e-bike, leaving behind a backpack filled with Monopoly money, a blatant symbolic gesture, and managed to evade a massive manhunt for 5 full days. This was not an act of passion. This was a mission. So, who was the man behind this cold and calculated attack? Well, the profile that emerged wasn't of a marginalized outcast, but of someone who had, by all accounts, walked the path of the American elite. His background is a fascinating tapestry of contradictions. And this table really lays out the symbolic clash at the heart of the story. On one side, you have Brian Thompson, the powerful CEO earning over $10 million a year, who was even facing allegations of insider trading. He was, for many, the very face of corporate healthcare. And on the other side, Luigi Mangione. He wasn't a failure by society's standards. He was a product of its most elite institutions, an engineer from an Ivy League university, a high school valedictorian, and, according to his own writings, someone who was personally suffering from spondylolisthesis, which, as we know, is a painful spinal condition. So this wasn't just a random act. It was a direct confrontation between two potent symbols of the American system. Now, the one piece of evidence that completely transformed this case from a straightforward murder into a national debate was what the killer left behind at the scene. He didn't just leave a body. He left a message, quite literally inscribed on his ammunition. Crime scene investigators found 3 spent bullet casings, and they also recovered 3 live rounds that were ejected when the gun jammed, and handwritten on them were 3 distinct words. This wasn't just a crime. This was a thesis statement delivered in the most brutal way imaginable. The first word was delay. Now, in the insurance world, this isn't just about making people wait. It's a well-known strategy. Some have called it rationing by inconvenience. The process of getting a medically necessary treatment approved is deliberately made so complex and drawn out that many patients, and indeed many clinicians, simply give up out of sheer exhaustion. The second word, deny. This is the core of the conflict for so many of us in the medical field. A denial is the blunt refusal to pay for a treatment that a qualified physician has deemed necessary for their patient. It's that bureaucratic wall we all hit, often hidden behind the benign-sounding term prior authorization. Now here's the crucial link. These words were not chosen at random. They are a deliberate and dark twisting of the title of a well-known 2010 book that was critical of the insurance industry, called Delay, Deny, Defend. The killer took this phrase and radicalized it. He replaced the final word, defend, which refers to defending denials in a court of law, with depose. And that one-word change shifts the entire meaning from a legal battle to a violent overthrow, a physical removal from power. This was his 3-word manifesto. The killer's message, as explicit as it was, clearly tapped into a very deep reservoir of public anger and frustration.
But this isn't just about feelings or anecdotes. There is hard, quantifiable data that paints a stark picture of a system that many people feel is fundamentally failing them. So let's have a look at the numbers.
19%. Just let that sink in for a moment. That was the average rate at which in-network insurance claims were denied for people on Affordable Care Act plans in 2023. That means nearly 1 in every 5 times a patient went for care they believed was covered, their insurer said no. And that's just the average. For some plans, the denial rate was over 50%. This isn't some rare, unfortunate event. It's a routine, infuriating part of the healthcare experience for millions.
So what happens if your claim is denied? Well, this slide shows the bureaucratic maze that patients and their doctors are forced to navigate. First, you have an internal appeal, which means you have to go back and argue your case with the very same company that just denied you. It's no surprise that less than 1% of patients even try. If that fails, you can request an external review. But the whole process is designed to be so complex, so time-consuming, that most people simply don't have the energy or resources to fight back. It's a war of attrition they can't win.
And this chart perfectly illustrates the central paradox that fuels so much of this public rage. The United States spends almost double per person on healthcare compared to other wealthy nations, yet for all that incredible spending, the outcomes are shockingly poor. U.S. life expectancy ranks a dismal 42nd in the world. And this wasn't just a random statistic. It was a point specifically mentioned in the killer's own handwritten manifesto. It's the core of the complaint, paying a premium price for a service that delivers subpar results. And there's another layer to this, the rise of automation. Major insurers are now facing lawsuits that allege they're using artificial intelligence and predictive algorithms to deny claims in massive batches, often without a single doctor ever looking at the patient's actual medical records. The accusation is that these systems are programmed to automatically flag claims for denial based on financial targets, not clinical need, essentially replacing medical judgment with a cost-cutting algorithm. So, given this backdrop of widespread frustration and systemic dysfunction, the public reaction to the assassination was, well, perhaps it was predictable, but it was no less shocking. The country didn't respond with unified horror. Instead, it fractured along lines of deep and disturbing division. This single number is just staggering. On the official social media post from United Health Group mourning the death of their CEO, more than 100,000 people clicked the haha or laughing emoji. Think about that. This wasn't some fringe group. It was a massive public display of digital mockery, a collective, bitter laugh from people who felt the system had been laughing at their suffering for years. And polling data revealed a truly stark generational divide. One survey found that a shocking 41% of young Americans between the ages of 18 and 29 found the killing to be acceptable. Now, while the majority still condemned the act, a number that high points to a profound breakdown of faith in institutions among the younger generation. They see a system they believe is fundamentally broken, and a significant minority seems to view even extreme violence against it as a justifiable response. Almost overnight, a strange and dark fandom grew around Luigi Mangione. He was being hailed online as a kind of folk hero, a vigilante taking on a corrupt system. People started selling merchandise supporting him. Copycat wanted posters targeting other healthcare CEOs started appearing around New York. Now, authorities were quick to label this a social sickness, but sociologists pointed out that it looked eerily similar to the anger seen during the Gilded Age, another period of extreme inequality where corporate titans became targets for a public that felt it had no other way to be heard. This assassination, then, really stops being about the actions of just one individual. It becomes a diagnostic tool, forcing us to ask much bigger, much more uncomfortable questions about the health of the entire society. And here we come to what is perhaps the most critical fact of the entire case. According to United Healthcare itself, Luigi Mangione was not one of their customers. He had no documented personal grievance, no specific claim that had been denied by this particular company. This really confirms that his motive wasn't personal revenge. He targeted Brian Thompson not for who he was, but for what he represented, the head of the most powerful entity in an industry the killer saw as fundamentally corrupt. He was attacking the system, embodied in one man. And so we're left with this final, deeply unsettling question. The murder of Brian Thompson was, of course, a horrific crime, and a man will stand trial for it. But the reaction from a significant part of the public suggests that in the court of public opinion, it isn't just one man who's being judged. This event has put the entire American healthcare system on trial, forcing a conversation that is long overdue
a conversation about profit, morality, and whether a system that is supposed to care for people has instead pushed them to their absolute breaking point. Thank you for joining me for this explainer.